What if I told you that snoring isn't just a harmless, albeit annoying bedtime habit, that it could be a sign of a serious health condition known as sleep apnea? That's right, folks. Sleep apnea isn't just about the symphony of snores that keeps your partner awake at night. It's a serious medical condition that affects millions of people worldwide, often without them even knowing it. And while snoring can indeed be a symptom, sleep apnea is far more than just a nocturnal nuisance. So what's the big deal about sleep apnea? Well, imagine this. You're sleeping peacefully, dreaming of a sunny beach vacation, when suddenly you stop breathing. For a few seconds to a minute, your body is starved of oxygen, before you suddenly gasp for breath, disrupting your sleep. This can happen hundreds of times in a single night. That's what living with sleep apnea is like. And no, it's not just about feeling groggy or tired the next day. Sleep apnea can have serious long-term effects on your health if left untreated. It's associated with conditions like high blood pressure, heart disease, and type 2 diabetes. It can even lead to problems with memory and concentration. But here's the kicker. Many people have sleep apnea without even realizing it. They might blame their daytime sleepiness on a bad night's sleep, stress, or just getting older. But these could be signs of a deeper issue. And what about the idea that only older, overweight men get sleep apnea? Well, that's another myth. Sleep apnea can affect anyone, regardless of age, gender, or body type. Yes, certain factors increase your risk, like being overweight or having a larger neck size, but sleep apnea doesn't discriminate. So it's time to say goodbye to the misconceptions and hello to the facts. Sleep apnea isn't just a bit of snoring or feeling tired. It's a serious health condition that needs attention. So now that we've debunked some myths about sleep apnea, let's delve deeper into what this condition really is. Understanding sleep apnea begins with examining its causes and symptoms. Sleep apnea is often the result of a combination of factors. Obesity, for instance, can lead to sleep apnea, as excess fat around the neck can obstruct the airway. Age also plays a role, with middle-aged and older individuals being more susceptible. And let's not forget about genetics. If sleep apnea runs in your family, you might be more likely to develop it. Now, there's more than one type of sleep apnea, but let's talk about the most common one, obstructive sleep apnea, or OSA. This is when your throat muscles intermittently relax and block your airway during sleep. A noticeable sign of obstructive sleep apnea is snoring. Yes, we're all familiar with the sound of snoring, but did you know it could be a sign of something more serious? If you or someone you know snores loudly and then becomes quiet, it could be a sign that breathing has stopped momentarily. This pause in breathing, known as apnea, can last for a few seconds to a minute and often ends with a gasp or choking sound. But sleep apnea isn't just something that happens in the night. It can affect your daytime too. People with sleep apnea often experience excessive daytime sleepiness or fatigue. They may wake up feeling unrefreshed, have trouble concentrating, and even experience mood changes. More severe cases of sleep apnea can result in decreased productivity at work or school, and it can even be dangerous while driving or operating machinery. So if you find yourself feeling unusually tired during the day, or your partner tells you that you've been snoring or choking in your sleep, it might be time to see a doctor. Other symptoms can include waking up with a dry mouth or sore throat, morning headaches, or even trouble staying asleep. Recognizing these signs early can lead to effective treatment and better health outcomes. Remember, sleep apnea is more than just snoring. It's a serious condition that needs attention. So, don't ignore the signs. If you think you might have sleep apnea, it's time to wake up and take action. Ignoring sleep apnea doesn't make it go away. In fact, it can make things a lot worse. Delving into the world of sleep apnea, it's crucial to understand the health risks associated with this sleep disorder. Untreated sleep apnea can cause a domino effect, triggering a series of health issues that may compromise your well-being. Let's begin with high blood pressure or hypertension. Sleep apnea can lead to this condition as it disrupts the normal sleep cycle. During these disturbances, the body releases stress hormones, which in turn boost your blood pressure levels. This constant fluctuation in blood pressure can strain your cardiovascular system, leading to hypertension. Heart disease is another serious consequence of untreated sleep apnea. When your body's oxygen levels drop during sleep apnea episodes, it puts significant stress on your heart. Over time, this can lead to an irregular heartbeat, heart disease, or even heart failure. It's a chilling thought, isn't it? Moreover, the risks don't stop at heart disease. There's also the potential for stroke. The sudden drops in oxygen levels that occur during sleep apnea episodes can increase the risk of developing a stroke. It's a silent threat that lurks in the shadows of the night, striking when you least expect it. And let's not forget about the everyday consequences. Untreated sleep apnea can lead to excessive daytime sleepiness, affecting your productivity, mood, and overall quality of life. It can affect your ability to concentrate, make decisions, or even operate machinery. But here's the silver lining. These risks can be mitigated. It's important to recognize the signs of sleep apnea and seek medical attention if you suspect you have this sleep disorder. With the right diagnosis and treatment, you can manage sleep apnea effectively and reduce these health risks. Remember, sleep apnea isn't a condition to be taken lightly. It's not just about snoring or feeling tired. It's a serious health issue that can have far-reaching consequences if left untreated. So, don't ignore the signs, take action, seek help. Because when it comes to sleep apnea, it's not just about poor sleep. It's a matter of overall health. If sleep apnea is suspected, a correct diagnosis is the first step towards better health. A sleep disorder as common and serious as sleep apnea necessitates a proper diagnosis, which can only come from a highly knowledgeable sleep medicine specialist. This specialist considers multiple factors before making a diagnosis. It starts with a thorough review of the individual's medical history and a physical examination. They may search for telltale signs such as a complaint of snoring and ineffective sleep, a neck size greater than 17 inches in men or 16 inches in women, a small upper airway, or high blood pressure that resists treatment. If a bed partner has observed episodes of stopped breathing, choking, or gasping during sleep, this significantly strengthens the suspicion of sleep apnea. But the diagnosis doesn't stop there. An overnight sleep study known as a polysomnogram is often employed. This study measures breathing effort, airflow, blood oxygen level, heart rate and rhythm, duration of various sleep stages, body position, and movement of arms and legs. It's a comprehensive examination designed to shed light on the individual's sleep patterns and potential disturbances. For those who can't undergo a polysomnogram in a sleep laboratory, at-home devices are a viable alternative. They monitor breathing, oxygen saturation, position, and heart rate, offering a reasonable alternative for those strongly suspected of having moderate or severe sleep apnea. However, this method is not recommended if other illnesses or sleep disorders are present, as they could interfere with the interpretation of the results. Diagnosing sleep apnea is an intricate process, but it's an essential one. It's the first step towards managing this common sleep disorder, and it paves the way for effective treatment options tailored to the individual's specific needs and condition. Remember, if you suspect that you or a loved one may have sleep apnea, don't ignore it. Consult a sleep medicine specialist to initiate the diagnosis process. With a correct diagnosis, effective treatment can begin. It's the first step towards reclaiming a good night's sleep, and more importantly, better health. Sleep apnea might sound scary, but the good news is that it's treatable. There are several options available, each tailored to the individual's specific needs and circumstances, ensuring that everyone can find a solution that works for them. One of the most common treatments is continuous positive airway pressure, or CPAP. This involves a device that uses air pressure to keep the upper airway open during sleep. It's like having a gentle breeze constantly blowing through your airways to prevent any blockages. The device includes a mask that fits over the nose or mouth, connected to a tube and a blower which generates the pressure. It might sound a bit intimidating, but most people find that it significantly improves their symptoms, and they quickly get used to it. Now, it's important to note that CPAP isn't a one-size-fits-all solution. The device needs to be properly adjusted to suit the individual's needs. This can be done in a sleep lab under the supervision of a technician, or at home with an auto device that has a self-adjusting pressure feature. But what if you're part of the 50% who find it difficult to adjust to the CPAP device? Well, you're not out of options. Some people find relief through lifestyle changes. This could mean losing weight, quitting smoking, or even changing sleeping positions. In more severe cases, surgery might be considered. This is usually a last resort, used when other treatments have proven ineffective. The type of surgery depends on the individual's specific condition, but it could involve removing or shrinking tissue in the throat or repositioning the jaw. Remember, dealing with sleep apnea is a journey, not a destination. Regular follow-ups with healthcare providers are crucial to monitor progress and adjust treatments as needed. As technology advances, new and more effective treatments are always on the horizon. With the right treatment, sleep apnea can be managed effectively, leading to better sleep and overall health.